Usually when you go out looking for any product that you look for somebody who specializes in it. If you're going to get your floors polished, you want somebody who works on marble and stone, whatever it is, a specialist. So from the beginning, we were specializing in spine. Everything related to the spine, from the base of the skull down to the tip of the tailbone. We weren't doing general orthopedics. We weren't doing knee replacements and taking away from that spine specialty. We weren't doing general neurosurgery, draining abscesses in the brain, taking away from that specialty on spine. It was solely devoted to spine, which was a new way of thinking and bringing everybody in who was devoted to that. We were the first to do that and have that singular focus. And there's other groups in town that have spine surgeons, but none of them specialize strictly in spine. When I came here to Reno, I was working closely with St. Mary's Hospital, and St. Mary's Hospital had as one of their priorities providing medical care to the rural communities. Nevada, if you look on a map, is mostly rural. There's only a couple cities in Nevada. It's unlike any other state. The population's really out, far away from the major cities in Nevada. So right from the beginning, I was going out to the rural clinics with some of the orthopedic surgeons. We had a plane that we could fly out to some places or drive out to places. It's always been part of our mission is to provide that care out to those clinics rather than having people drive in 300, 400 miles to see us. If we could set it up so we could afford to send a doctor, set up a clinic out there, we did it. So that model has worked out. St. Mary's Hospital helped us do that with their outreach. Of course, St. Mary's has gone through a lot of different ownership now, and they no longer do that, but we still do that. We maintain clinics in Elko, Nevada. It's over 300 miles away. We have patients from Winnemucca. We've got physiatry and pain management in Winnemucca. Overall, the main trauma hospital we work at, Reno Regional Medical Center, has the busiest emergency helicopter service in the country because our distances are so great here. It's not that there's so many people, but the distances are so great that many people are getting evacuated by helicopters. The only way to reach them, get them more quickly into these hospitals. So we really have people flying in from all over the rural areas, from the southern part of Idaho, the northern part of California. Over the years had fellows in sports medicine and spine here, and they move out to their own practices. So even some of those doctors in places as far away over the Sierra Mountains, like Redding, California, we have patients coming in from those areas to get their care here when it comes to having super specialists in spine. It's a normal state of human existence to have neck pain or back pain intermittently through your life. Of all the people that have back pain, that's enough where they're concerned in seeing a doctor, which is about 80% of Americans, they estimate, will actually have such severe pain they seek care. But of those people that actually come in to see a doctor, only about 3 or 4% actually require surgery. As a surgery office, patients are being screened by the primary care doctors, chiropractors, physical medicine, pain management doctors. They're seeing them first, but when they feel like they failed with that, they're sending them here. So you would think that everybody walking through the door who's being sent for surgery is pretty much going to be a surgical candidate. No. We find that our rate is approximately only 10% of the people that are sent here for surgery actually need surgery. Why? Because we're able to use advanced non-operative treatments. We may not do those treatments ourselves, but we know about them. We prescribe, we've set up a treatment program for that patient. You've got all sorts of injections that can be done for inflammatory conditions. You've got nerve blocks that can be done. You've got more permanent type of nerve blocks called radiofrequency ablations. There's very specific sorts of exercise therapy that can be done if you know where the diagnosis is. And then there's advanced medications that you can use for pain. Pain isn't just one sort of thing in everybody. There's inflammatory pain, there's autoimmune types of pain, there's psychological pain. So we're good at looking at that pain and understanding where it comes from and then giving the right treatment recommendations. And there's, so many people, we don't need to operate on everybody that comes into our office. In fact, we're trying to put that aside, and even though that's our specialty is the surgery, give them a treatment program that's designed for them, which may or may not include surgery. Just in general, surgical techniques, like we started this discussion out, this is the area that has expanded most rapidly in medicine. So we have surgeries which can take multiple hours, 6 hours to correct a deformity, putting in titanium rods and screws, using robot assistants and computer guided assistants to put these screws between nerves so they don't cause damage. And going from that extreme all the way down to surgery where we're really working through almost a large needle, making puncture in the skin, using fluoroscopic guidance and neuromonitoring, going into a fractured bone, putting in different types of high pressure balloons that will expand to different shapes to restore the bone to its height, filling it with an acrylic cement or a bone substitute and curing their fracture and their pain right that way with an incision that is literally 1/4 of an inch. And then they wake up and they're able to go back to doing whatever they want to, really no recovery. So it's just an extreme of things from the major open surgeries down to something like the kyphoplasty. In between we have the microscopic surgery, big microscope, the assistant surgeon. There can be 2 of those. Each is able to see through the microscope. It's 3-dimensional. Work on tiny blood vessels, herniated discs, tumors. So there's a full gamut of the type of surgery and what it involves. Some surgeries can be done in the office. Some are done at outpatient surgery center. People may wonder what that is. Well, outpatient surgery center can provide the same type of equipment and tools that you'd have in the hospital, but it's outpatient. The patients there are healthier, so there's less chance of disease transmission, healthier patients, quicker recovery. The staff there does the same thing over and over. They're more expert in it, less mistakes. Overall satisfaction rate for patients treated at surgery centers in this state is much higher than patients treated for the same problem at a hospital, and much less expensive. I mean, some people have to take that in consideration. They're paying a copay. That surgery center could be 25% of the cost of a hospital procedure. If you're talking about something like a herniated disc and you're doing a microdiscectomy, it could be 75% less expensive to do it at an outpatient surgery center with a better success rate. But then we go on to major hospital cases where maybe patient's been in a big car accident, trauma. Dr. Williams does a lot of that. ICUs require days of hospitalization, maybe weeks of rehab on that. So it's a full gamut of what we do and what's involved with spine surgery.